Good morning or good afternoon, everyone. Keep enjoying your luncheon. We're about to start our last session, and I'm gonna bring up my boss, Executive Director Ron Pollack. Before that, just two quick announcements. We would love to hear what you think about this conference. There are evaluation forms on your table. If you've run out of forms, let us know. There should be a few on every table, so there is enough in this room. You can also evaluate us if you downloaded the Health Action 2014 app on your mobile device. There's an evaluation piece there. It's how we know what to do next year. We look at evaluations very seriously, so we hope you fill those out before you go. Last little bit of fun item. I've been talking about this all week. If you get a chance, please walk up here and check out the painting that Regina Holliday did for us this morning at that fabulous session on social media and healthcare. What's really fun about it is there's these mountains, it's rocky, there's these patients who are being carried by balloons, and if you see it from far away, they just look like balloons, but if you come up close, you can see that she's put little social media insignias on the balloons, so it's very meaningful for that session. And they're patients wearing patient gowns, and some of the gowns are open in the front, and some are open in the back, but it's pretty cute. So we entered all of you who used social media, who used Twitter to talk about Health Action 2014, and we have a winner. It's Amy Lynn Smith from Michigan. And I know Amy was a big fan of this morning's session because I was following her on Twitter. So Amy, you win the painting. Is she here? Yes, she's here. She's right back there. This is all yours. Come on up. And Regina wanted to give it to you, but it's snowing in Western Maryland, so she had to take off. Okay, thank you. Are you ready, Ron? I don't know if we're going to get this mic to work.
So hi, we're going to start the session. To open up, we're going to show you a video, a whiteboard video that was produced by a woman named Maggie Dutre. Some of you know her dad, Joe Dutre. He's a real activist from Maine who's been leading consumer activism in the state of Maine, and my understanding is we got a shot at getting the Medicaid expansion in Maine. So we're going to show you this video, and I hope you like it. Thank you.
Need help paying for health coverage? Help is finally here. Many millions of people are now able to get health coverage through new health insurance marketplaces. These new marketplaces, which are different from state to state, can be accessed through newly improved websites and through toll-free phone numbers. Through the marketplaces, individuals and families who get health insurance on their own can get private health plans at good values. These health plans cannot be canceled or denied if you have a pre-existing medical condition or illness like asthma, diabetes, high blood pressure, or a history of cancer. Insurers can no longer charge you discriminatory rates based on your health status, which means even if you are currently sick, your rates cannot go up as a result. And women can no longer be charged higher premiums than men based on their gender. Furthermore, insurance companies can no longer put annual or lifetime dollar limits on your coverage, even if you're in an accident or have a serious illness. The marketplaces make your search for health coverage easier by gathering the health plan options available in your area in one place. You'll be able to compare plans based on premiums, benefits, out-of-pocket costs, and other features that matter to you before you make a choice. These health plans will have to cover 10 important healthcare services, including preventive care like annual checkups, hospital stays, care by doctors and specialists, and prescription drugs. When you fill out the online marketplace application, you will find out if you can pay lower costs for
So I hope you find it. I hope you find that useful. Some of you may want to have a video like that, and we're not trying to proselytize Families USA, and we can have your logo on there so that you can use it and gain the organizational benefit that you find useful. So let us know if it's something you want and you find useful, and we can get this modified in such a way that it's got your logo at the end. So we will have it on our website, and we hope to share it so that others can make use of it as you think is useful. So we're now going to have a wonderful treat, and it's a great treat for me to have the opportunity to introduce our next speaker. Our next speaker is going to be Texas State Senator Leticia Van de Putte. And we are really honored at Families USA because Leticia has agreed to join our board. She's been a board member, and you've already seen the imprint. We had bookends for the conference, Mayor Castro and State Senator Van de Putte. In between, we got Kentucky and so on. But we're really thrilled with her joining our board. As you'll see, she has deep passion, speaks with great eloquence about the need for health coverage and care for everyone. She represents a large portion of San Antonio and Bexar County. She represents Senate District number 26 since 1999. Her effective work on behalf of her constituents and people throughout the state of Texas have been well recognized. Last year, she was unanimously elected by her colleagues as Senate President Pro Tem of the 83rd regular session. After the regular session, she was named by Texas Monthly's list of the 10 best legislators. And on May 4th, 2013, she served as governor for the day. Now, we're kind of upset that she was not governor for the other 364 days. But at some point, I have a feeling that will change. We're a 501c3 organization, so we can't talk about partisan politics, but I think you're going to hear more of Senator Van de Putte in the days and weeks ahead. She cares deeply about health care. She's a practicing pharmacist. She's the mom of an OBGYN, and she has co-sponsored or authored numerous important pieces of legislation, including extended a successful county program to address the needs of children with behavioral health issues, expanded peer-to-peer mental health programs for veterans, and required out-of-state compounding pharmacies shipping drugs into Texas to have them first inspected. And she is as strong an advocate for getting the Medicaid expansion in Medicaid. Please give a warm round of applause for Senator Leticia Van de Putte.
Thank you. Muchísimas gracias. Thank you. I thought I heard some Texans out there. We're normally a lot louder. But as you could see, with regard to healthcare, we don't have a whole lot of boasting. It is great, though, for me to be here. And as a board member of Families USA, let me tell you how proud we are that you have given the most precious gift that you have, and that's the gift of your time to be here. And what a fantastic 3 days it has been. Great information, I know, great networking. But the board would really like to thank Ron and your staff for putting this together. They've done a great job. Thank you, Ron, and thank you to all of our great Families USA staff. Well, I know that many of you may have gotten to hear my mayor, Julian Castro. I hope that you were able to see him at the beginning of the day. And I would put these on, but I think I might have to. You see, I'm bilingual, bicultural, and now I'm just bifocal. So I know that you hopefully got to hear my mayor, Julian Castro. And if you look at the future of the state of Texas, you're looking at it in Julian Castro. It's that youth, it's that energy, it's that vibrancy, it's our changing demographic. And he is certainly a person with vision, and he has led with vision. He understands that a bright future happens only if we plan for it today. And last year, or a little over a year and a half ago, he convinced the voters of the city of San Antonio to use a piece of legislation that I had authored 10 years before called the Better Jobs Act, which said that a community can tax itself to provide for important things that would lead to better jobs. In the human capital side, like quality pre-K and middle school mentoring and job training for our high schoolers and career choices. And I passed that law, and for 10 years I couldn't get anybody to take me up on it until Mayor Castro put through the effort, and we have pre-K for SA now, a vision where all San Antonio children will have quality full-day pre-K. And that's why he came here. It's because he supports what you're doing and Families USA, because he knows that preventative care and that the wellness of a community depends on its health status, and that obtaining affordable health insurance is a key ingredient to the capacity and sustainability of any American town or city. And I'm very proud of the work he's done. So it's really a privilege to be here in a room that is defined by that dedication to service to others. You know, we started the week in San Antonio with our Martin Luther King Day March. And I've got to tell you, I marched arm in arm with the mayor along with 175,000 of our closest friends. It's the largest MLK march in the country. And it's not a parade, it's a march. And it starts out with the garbage truck, with the homage that Dr. Martin Luther King was marching for the dignity of those garbage workers and their families. So it starts out with a garbage truck, and we march behind it. And, you know, when we looked at this week and Families USA positioned strategically about the timing and what's happening in our country, I couldn't help but think of what Dr. Martin Luther King said. And he said so many wonderful and prophetic statements that were strong. But one thing that he said was about service to others. And my quote that I love from Dr. King is, "Life's most persistent and urgent question is, what are you doing for others?" What are you doing for others? Well, you in this room, you've answered it. You every day are doing for others. That's the question I think that motivates me and my work, and I know it's what motivates you. And whether you're aware of that quote or not, you're the living embodiment of what you are doing for others. And let me tell you, in Texas, not everybody kind of shares that sentiment. As most people do across the country, they get up, they go to work, they go to school, just with a vision at the end of the day that they can live a life of dignity, and that the next generation is going to have it a little bit better. And that's what happens in San Antonio, that's what happens in Texas, that's what happens in Alaska and Hawaii, and that's what happens right here and in Maine. People are hardworking every day, but they know that their visions and their dreams can be cut short because of ill health, a chronic condition, or a catastrophe. And I can tell you that as a pharmacist, and I still work at Davila Pharmacy. It is, it's in the barrio, so let me describe it is the most vibrant place. I can be there working a shift for 8 hours, and I know exactly what's going to happen with the next bond election at the schools, right? I can tell you who's doing a good job locally and the officials and who's not. But it's a place where the health status in that zip code is not too good. And it's the communities that we really have to get to. And all of you know what communities I'm talking about. If you take that dynamic of statistics and data, which we all need, and you put it to use, you look at the zip codes that have the highest number of children in poverty, highest number of referrals to juvenile probation, lowest number of home ownership, highest teen pregnancy. You got the picture, right? You know that those are the determinants where people are very mobile. And it's not usually just that census tract or zip code. It's usually the ones around it, right? And then the ones around that one. And every day in our rural communities, it's those folks that are really struggling. And so I've got to tell you what happened the day that the court decision came down from the Supreme Court. Now, I'm working at the pharmacy, and we have the TV on, and it's a big, big TV that faces our patients as they're waiting. It's a full-line pharmacy, but we also really geared towards special needs children and adults and chronic conditions, so a lot of medical supplies. So while other maybe pharmacies might and places might be a retail out and where they've got garden hoses and stuff, our front end is ostomy supplies and all of the things that you need for diabetic care. And so the alert came on, and we had CNN, and they said the decision has come down. And as you know, it was a little bit complicated, right? And so the first thing, it was like, oh, this happened. And then when they finally said, and the Affordable Care Act has been upheld, the cheers came from the people standing at the pharmacy. The cheers, the overwhelming gladness and joy from the patients, from the people, not the elected leaders, not the folks, but I could see that, and you could feel it, that if there was hope, that there was somebody thinking that healthcare was so important, that the Supreme Court said, yes, it is your right to have healthcare. What a powerful statement that was. And they cheered because they knew how badly they needed it in that neighborhood, in that barrio in San Antonio. Most folks are hardworking and plow, and a high school diploma is a big deal, a big, big deal. You know, it's where that teen pregnancy rate is 2 times the higher than the state average, and our state ain't doing that great anyway. And it's where the median household income, the per capita income in that area is $10,000 a year. And the median household income is $25,000 a year. Those are the people that cheered. Those are the people that were so excited, even though they know that they are within 1.5 miles of a hospital, and of a children's hospital. Just having the proximity of healthcare facilities doesn't always mean that you get to walk through those doors, that you get to walk into a clinic. Maybe the emergency room when all else has failed, and you know that if you don't get your child there, something serious is going to happen. And so I want to tell you, as a state that has not embraced and has been hostile and toxic, I want to congratulate you in those red states that you have found a way to get to your leaders to convince them that their love for the people who live in your state is greater for the dislike of this current administration. So thank you to the folks in those red states who have done it. And it's shameful for what we're doing in our state. I mean, not only is it a no, it is like a double emphatic no. Even though 25% of our folk just don't have health insurance. And we've got 6.4 million uninsured. And when they said no to the Medicaid expansion, that also meant no to 68,000 veterans in my state for them to have health care. And that's why what you do is so important. I feel it, I know it, because I'm in a hostile and toxic environment. And those of you working in those areas, your work has to get done. But it has to get done everywhere. I have a staff member who always tells me it starts with a conversation. And sometimes that people hear different things. So you and I, when we say ACA, right, we know what we're talking about. But other folk may not. And it all begins with that conversation. So I want to share a story with you, a true story, about how sometimes perceptions get translated and then how people act. So, you know my oldest daughter's an OBGYN. She's, I think 33, 34. I don't know, because we had 6 kids in 9 years. I'm sorry for the folks from all the planned pregnancy part. I was not really good at that. But it was our choice to have 6 children in 9 years. And so our oldest is, I think, 33, and our son Paul is 24. And we have real success. They're all out of college. And they're all on someone else's health care plan. That's real success, because they have a job, you know. That's real success. But when they were little, it was very chaotic at our house, organized chaos. And of course, this was one of those days where one of the car was broken down, and we were trying to take all the 6 kids to school, and my husband was trying to hurry me up, and the book bags and the sporting equipment. Well, you know, you get the idea, the lunches and the stuff, trying to pile 6 kids, me and Pete, in the van, make the trek all around with the 2 schools that we had to go to, plus dropping Pete off and then me at the pharmacy. And right before we were about to leave, the phone rang. This is when people actually answered their home phones, you know, before a lot of cellular use. And so I answered the phone, and it was someone from the American Pharmacy Association in DC telling me that I was going to be the recipient of the Hubert Humphrey Award. And I was overwhelmed. Now, those of you that went to school with the slide rule know who Hubert Humphrey is. He was our vice president. But you may not know he was a pharmacist and really worked so much for healthcare and for health, period. And the top award to a public servant that's a pharmacist is named in his honor. And they were going to give it to me. I mean, you know, how cool is that? Because the affirmation that you get from your peers, as you know, is the best affirmation you could get. So we're in the car, and I'm explaining to Pete that I've just received this phone call, and I'm going to get the Hubert Humphrey Award. And I'm crying, because for me, those were tears of joy. Well, we're driving, and pretty soon the kids start to chime in. And they say, "Mommy, that's not fair." And I turn around and look, and I said, "What are you talking about?" And Pete's driving, and he says, "What are you talking about? What do y'all mean?" And they said, well, Mommy can't help that. And Pete turns around and he says, "What do you mean Mommy can't help that?" She says, "Well, we don't understand. Why is somebody in Washington, D.C. being mean to Mommy? We thought only people in Austin were mean to Mommy." And Pete is very engaged, right? And I turn around and I said, "What are you talking about?" And then my middle child says, "Well, Mommy, you can't help it because you're so fat," right? Immediately, Pete Vandepute is out of the conversation. We've been married for 36 years, but he knows this is it. I'm out of this conversation. And I turn around and I said, "What are you talking about?" And one of my other kids says, "Well, Mommy, you're just so big because you had so many babies." And I said, "Well, yeah, but why are you saying this?" And they all gathered and they said, "Well, we've talked and we don't think it's right that somebody is giving you the Humpty Dumpty Award." True story. You see, in their little developing minds, there was no reference point for Hubert Humphrey. What they heard was Humpty Dumpty. And so what was a joy, really they thought was an insult. But as I thought about that, and I think about what you do. A lot of Americans are Humpty Dumpty, okay? Not that they're overweight, although a significant amount are, but aren't so many families just sitting on the ledge? They're sitting on that wall, and they're just about to teeter over, right? They're just about to lose it, and they're scared, and they're burdened with useless worry because they're so scared. I'm not going to make that house payment. How am I going to pay for this? And oh, even if my child is in National Honor Society, the price of college is out of the way. And what if somebody gets sick? They're on that edge, so they're Humpty Dumpty. But no fear. Because as you know, it says, and all the king horses and all the king's men tried to put Humpty together again. And as I thought about that, you are the king's horses. You are the king's men. You in the communities that get those programs. You in the community that are making sure that those families aren't on that wall, that they're going to fall off. You doing it. You may not be royalty, but in my eyes and in the eyes of so many people, you are royal. You are doing the work that makes you noble. And so maybe you help people that are like the Humpty Dumpty. You do it every day. Some of you under terrible conditions. And that's what the Affordable Care Act is about. Making sure that nobody falls off that ledge, that they're able to get the help that they need preventatively, that one catastrophic illness doesn't lead to bankruptcy. Now, I know that there are still foes out there that are trying to stymie your work. And believe me, I feel it. I'm in a state where they tried everything to increase the cost and the educational requirements for our navigators. I mean, it was even going to cost them $800 extra and 40 more hours of training. Luckily, we were able to scale that back a little bit. But smart people, business folks are understanding that this is an economic survival program, that the well-being of our communities is really the health, not just the health care, but that people cannot do their best if they're in constant worry of thinking, I don't have enough for a child's antibiotic. I don't know what'll happen if my high blood pressure isn't contained. And you know, I see those people. They come into the pharmacy and they have that look of total despair because they're coming and they're asking me for stuff that maybe they can find over the counter that'll help. And then when I try to tell them, I said, no, you really need to get in to see a doctor. And they say, well, I don't have insurance. And I'm working 2 jobs. So I urge you, if you have not utilized your independent pharmacies, not that the chain pharmacies are not going to help in the promotion of the ACI, I think a lot of them have. But it's your independent pharmacies that are in your rural communities, you know, those mom and pops, and they're also in communities of color. Because let's face it, in a lot of those communities, you're not going to find big chains. Go to your local pharmacies. Our patients walk into your pharmacy 6 times more than they walk into a doctor's office. And that's for everybody, even with health care. So utilize those independent pharmacies as the reach outs, because they're coming. They're coming, and I can tell you that we already have been able to steer people, particularly those young invincibles, because they come in, and usually they come in with a sinus stuff or for antibiotic, and they're paying cash. And so I say, you not have insurance? Oh, no, I don't have any insurance. I said, do you know you can have insurance? I can? Well, I'm a student. I work part-time, but I'm a student. He was 24 years old. He said, you mean that Obamacare stuff is for me? I could do that? Yeah. And let me tell you, here's a number to call if you want to call, or here's the website you want to. Knows that he's heard about it, right? but not thinking until all of a sudden he got a really bad sinus infection and had to go to the doctor and paying cash. That's the opportunity if you link up with those community pharmacies. So I ask you to do that. We're really proud of the work that you have done. And we know that we got a lot of work to do, particularly in those states that aren't as enlightened, that haven't expanded their Medicaid. Our decision in our state not to expand Medicaid was a terrible business decision. You get the social justice part. You get what happens to families. But in my state, we said no to $4 billion worth of health care services and an additional 200,000 jobs. That's a bad business decision. That's why we got resolutions from 23 chambers of commerce begging us to expand Medicaid. That's why groups like the Hospital Association, the Medical Association, that's why they all wanted to. We had the faith-based community, they got it, they understood. But it is still a lot of work to be done, so don't give up. And I know that you don't need to give up. I was lucky. I got to go to a great public school, and I got to go to pharmacy school, and my parents went to college. So I'm not the first generation in my family. I am so blessed. It was never a question of, well, is Leticia going to go to college? It was, where do you think she would like to go? But I still grew up in a very traditional Mexicano family. My grandmothers both came from Mexico, and neither of them had more than a third grade education. But my one grandmother that was born in Guadalajara, oh my goodness, she could write, and she could write poetry. And she would leave us these little dichos, these little pearls of wisdom. And some of the things that she would write still resonate today. One of my favorite ones is, El que sabe que no sabe, sabe algo, which means, if you know what you don't know, you know something. And our world is really complex. We don't know what the political changes are going to be. We don't know what event around the world is going to propel an action by the United States. But what we do know is that health and health care is the bedrock of any family's success. Education. But a sick child cannot take part in an educated family. And we know that it's health and health care. And so I want to leave you with my dad's favorite story. Daddy was an English teacher, and he loved Robert Louis Stevenson. Loved him. And there was this one particular story that he tells about Robert Louis Stevenson. By the way, he was a very sickly child. Came from a pretty wealthy family, but he was a sickly child. And what they would do was his nanny would take him, he was on the second floor, and would stay with him much of the day because he was too ill to go out and play. But at night, right at dusk, he loved for that nurse, that nanny, to go to take him to the window. You see, what happened in his neighborhood was that the lamp lighters would come by, and he would love to see the lamps being lighted. One day, the nursemaid asked, why do you want to see the lamplighter? You see it every day. And although the work is the same, you watch the man go up the ladder, light the gas light, come down, move the ladder to the next limelight, light it. It's the same work. And it's valuable, but why do you keep wanting to see this? And his reply was, it's not that I like seeing the man doing the work over and over. I like to watch him punch holes in the darkness. That's what you do. You're punching holes in the darkness. You're punching holes in the darkness of despair. You're punching holes in the darkness of people who don't know that there can be a better tomorrow. You're punching holes where there has been no hope before. You're punching holes so that our standard of living in the communities that we live in, and that the capabilities of the people reach the potential. You're punching holes in the darkness. And I thank you for it. And we thank you for it. And we want you to keep doing it. Keep punching those holes. Muchísimas gracias. Thank you for being here. And may God bless you as you head on home.
Thank you so much. It was beautiful. I want to thank a number of people who made this conference possible. It truly is a staff-wide effort. So I'm going to thank a few people. And Jen Beeson, one of her extraordinary qualities is she tells me about my various shortcomings. And one of those shortcomings is that I speak much too slowly. So I'm going to, after I mention a couple of people by full name, I'm going to do first names only, because Jen was afraid that if I use full names, we'll be here till Health Action 2015. So of course, everything starts, ends, and in the middle with Regina Wise. Now, because the lights are, it's not that easy to see throughout the room, I wasn't sure she was going to be here, but I think I see her in the distance. Amy Smoocha. Amy played a great role, particularly with our stateside team, in getting the conference together, and I'm thrilled that Amy is here. Thanks so much, Amy. I want to thank, I don't see her, Maria Vogel. Is she here? Maria makes... She really makes all the trains run on time. She's been an extraordinarily wonderful person to work with. Thanks so much, Maria. So Jen, I'm going to have to thank you too, because you took over to help coordinate. Please thank Jen Beeson. So now I'm supposed to, according to Jen, do first names, otherwise I'm going to be pretty long. So Jen, aye, Capitan. So on our stateside team, in no particular order, they're all wonderful. Josie and Lizette and Mike and Stephanie, Tony, Jewel, we have a couple of Kates, so Kate Blocher, where's Ben? And Shannon, Megan. Now, I want to thank also, we have this active process of Radio Row that really is extraordinary. And Dave, if you don't mind, I'm going to start with Brian. So our communications team, Dave and Bob. Where's Arian? Arian, there he is. You know, and then we've had a whole bunch of team who were reporters, editors doing live blogging and tweeting. What's tweeting? So Megan again, and Kate again, and Justin. Where are the two Justins? Talia, Carla, August. So, you know, this is a team effort, and other people on the staff who I didn't mention all put in a lot of time and a lot of effort. And we get energy from this conference because we see our colleagues, we see our friends, we see the folks who are on the front lines, and it really re-energizes us, and we hope it re-energizes you. There's an old song that a friend of mine worked in the civil rights movement and various other movements in Appalachia and the labor movement, wrote a song that I keep on thinking of when I come to these health action conferences. And the key line in the song is, I won't sing it, I promise, is people like you help people like me carry on, carry on. So we all will carry on together. And thank you so much for coming. We've got lots of good work ahead of us in this year, and we look forward to seeing you next year. Thanks for coming.